What this does is it provides exactly the same thing that the congressman from Pennsylvania was going to provide, that the health insurance exchange created under Virginia law, which will include subsidized insurance coverage, will comply with the standards that we've set here in Virginia and that the Hyde Amendment has provided in Washington for 30 years, and that is that taxpayer funding will not be provided for elective abortions. It is as simple as that.
In the exclusion, it says it would not apply if the life of the mother is in danger, and it goes on to say physical disorder, physical illness, or physical injury. Do you not believe that mental illness is an actual illness?
No. And frankly, I mean, that may be a bridge that you and I are not going to be able to get over. My concern about the so-called emotional health kind of provisions is that they become so open-ended that they're really virtually useless. And the question about adding that is one that I respectfully submit is not appropriate. I mean, if that would satisfy your concerns and you would look favorably on this, I wouldn't be thrilled. I wouldn't support that amendment, but I suspect you've got the votes to put it on it, and I'd love to see this continue to move forward.
Does that complete your question?
Well, just in response, say that's not my only concern about this.
I was hopeful. Eternal optimist.
Question?
Well, my feeling is that if, insurance companies come forward and offer a great rate and their policy includes that, the taxpayers' money is really not involved right here. It's the people's or the business's individual money, and we ought not to be telling these people that you can't, either the insurance companies or the people who want purchases, that they can't offer and you can't buy a policy if you're part of the exchange, which provides for abortion services.
Mr. Chairman, in responding to Senator Saslaw, I hear your concern, but in keeping with the theme of today, you can't be just a little bit pregnant.
Oh, I understand.
And
I know where you're coming from.
And the whole statutory scheme has been set up in a fashion in which there are going to be taxpayer dollars that are going to be used in funding and in subsidizing these policies. And as a consequence of that, we've got this difficult, thorny issue that we've been dealing with in Washington and Richmond for 30 years as to whether or not we're going to use taxpayer funds to fund abortions. That's really where the dispute comes in. If it was all private money, I would say, you may have a darn good point, but the way it's structured, you just can't make that kind of a distinction.
Senator?
Mr. Chairman and members of the committee, I'm Anna Francinello with Americans United for Life, a national public interest law firm with a practice in abortion and bioethics law. And in the interest of being brief, which is a tall order because I'm both a lawyer and a woman, I have prepared written testimony for the committee. So can I give this to the clerk to...
We'll be more than happy, and Paige will take the testimony.
Thank you. I have co-written legislation and administrative comments addressing numerous provisions in the Patient Protection and Affordable Care Act, or PACA. The substance of Senate Bill 1202 closely mirrors the AUL model bill, the Abortion Mandate Opt-out Act, which we carefully drafted to be both constitutional and permissible under PACA. I appreciate this opportunity to testify as to the constitutionality, the need for, and the permissibility of Senate Bill 1202 under PACA, and why Senate Bill 1202 is consistent with Virginia law and public policy. First, Senate Bill 1202 is constitutional. The United States Supreme Court has repeatedly affirmed the constitutionality of federal and state restrictions on public fundings for abortion. The court's decision in Harris versus McRae, upholding the constitutionality of the Hyde Amendment, a federal appropriations rider that restricts the use of federal and state matching Medicaid funds for abortions, is particularly relevant because the Hyde Amendment, like Senate Bill 1202, restricts federal subsidization of insurance plans that cover abortions. Second, Senate Bill 1202 is permissible under PACA. Section 1303A of PACA explicitly provides a state may elect to prohibit abortion coverage in qualified health plans offered through an exchange if such state enacts a law to provide for such prohibition. Further, PACA does not require a state to permit abortion coverage through a separate optional rider. Senate Bill 1202 does exactly what Section 1303A of PACA permits a state to do. It prohibits insurance plans within the state exchanges from covering abortions. Third, an opt-out like Senate Bill 1202 is necessary to prevent insurance plans that cover abortions from receiving federal and eventually state subsidies in Virginia state exchanges. Because PACA self-appropriates its funding, the Hyde Amendment, a yearly rider to the Labor, Health, and Human Services Appropriations Bill, does not apply to PACA. Instead, PACA provides that qualified health plans may provide abortion coverage to enrollees. This is a departure from the status quo on abortion funding. The Hyde Amendment and other federal programs, such as the Federal Employee Health Benefits Program, prohibit federal subsidies from supporting insurance plans that cover abortions, regardless of whether the federal dollars are used directly to pay for the abortions. While President Obama's executive order references the insurance exchanges, it failed to apply the Hyde Amendment to them. In contrast, the executive order simply calls for strict compliance with the abortion surcharge provision in PACA. Therefore, the Commonwealth of Virginia must enact a law like Senate Bill 1202 to prevent insurance plans that cover abortions from participating in exchanges operating within the state. Finally, law and public policy in the Commonwealth of Virginia supports opting out of permitting abortion coverage through the state exchanges. Citizens of the Commonwealth of Virginia, like other Americans, oppose the use of public funds, both federal and state, to pay for abortions. Thank you, Mr. Chairman and members of the committee, for this opportunity to testify.
Louise Hodson, Renfrew County, representing the Virginia Society for Human Life. We support this legislation. Thank you so much.
Mr. Chairman, members of the committee, Chris Friend of the Family Foundation, in support.
Virginia Assembly and Indianapolis, we support this.
Jeff Russo with Virginia Catholic Conference, we supported this bill.
Mr. Chairman and members of the subcommittee, my name is Jessica Conkey, and I'm the Director of Public Policy for Planned Parenthood Advocates of Virginia. I'm here today to oppose Senate Bill 1202. I would like to first point out that there are no taxpayer dollars, not federal dollars or state dollars, that would be paying for elective abortion coverage in any private insurance plan sold in Virginia's exchange. That is specifically spelled out in the Affordable Care Act. The Affordable Care Act says abortion can only be covered with federal dollars when it is the case of rape, incest, or threat to a woman's life. Otherwise, the abortion has to be paid for with private premium dollars only, and those have to be strictly segregated from any federal subsidies being used by the insurance policy. Since this is not about taxpayer dollars, then it is about private premium dollars and insurance policies being sold by private insurance companies. Since when does our state tell people they cannot spend their own money on something a private company wants to sell them? A prohibition on private insurance companies covering abortion care would mark a stark departure from the status quo. In the current private health insurance marketplace, most health plans provide coverage for abortion services as part of the broader health care package. Senate Bill 1202 is particularly harmful to those most vulnerable women. This bill allows insurance coverage for abortion in only the narrowest of circumstances. If a woman's life is in danger, rape or incest. But this standard excludes many circumstances where a woman's health may be at risk if she continues a pregnancy. For that reason, it might force a woman to risk her health because she cannot afford to end the pregnancy, even though it is necessary to protect her health. For example, if a pregnant woman is diagnosed with cancer and wants to end her pregnancy so that she may begin chemotherapy. Further, if a woman needs an abortion due to a fetal anomaly, she would be forced to pay for the care she needs out of pocket, which, like if her health was threatened, could cost several thousands of dollars at a minimum. I lastly would like to point out that the federal health care exchange reform law does not require state health insurance exchanges to be in place until 2014. Many departments here in Virginia are currently doing research and planning needed to build a better health insurance marketplace and determine how Virginia's exchange will be operated and governed. Given the time frame, there is no reason for the legislature to take this matter up at this time. That all being said, this bill is an unprecedented attempt to take comprehensive private health insurance coverage away from women in the Commonwealth. Abortion is a legal medical procedure and most insurance plans cover it. In a time of economic uncertainty and hardship, Virginia should be doing everything it can to provide help to women and families. The last thing we should do is take important coverage away from them. Thank you for your time.
Thank you.
Good morning again. My name is Tarina Keene. I'm the Executive Director of NARAL Pro-Choice Virginia, and we are here to oppose this bill. No woman ever plans on having an abortion. But insurance coverage is there when the unexpected occurs. That is why most private insurance plans already include coverage for abortion. In fact, many women do not even realize they have this coverage until they absolutely need it. And thankfully, for most women, it's already there. What we are talking about here today is giving you, the government, the ability to impose your will on how people spend their private money and make private decisions. It also restricts private companies from selling a product people want to buy. A majority of insurers operating in Virginia today already offer abortion coverage in their plans. Furthermore, the Commonwealth has never before prohibited insurers from covering a particular benefit in private plans. This bill is government intrusion at its worst. It goes against our free market capitalistic principles, and it goes against our democratic values. Proponents of this bill claim taxpayer dollars are going to be used to pay for abortions and the new health care exchanges. And while we may not know exactly what the federal government is going to decide what's in the basic health care exchange, we already know and have our answer on how abortion will be covered, or won't be covered. Congress and the Obama administration took great pains to ensure that abortion is not paid for with taxpayer money. In fact, the president issued a signing statement that said the Hyde Amendment applies to all federal plans, or all federal funds used to subsidize health care for individuals and small businesses. I don't know how much more explicit you can get than that. There's absolutely no way anyone can claim that taxpayer money, whether state or federal, is going to pay for the abortion in the exchange. Health care reform was designed to open up the doors for people who for too long have gone without health care and health insurance. It was designed to protect people's health, not impede it. And although government is the conduit for citizens and health care, it is not the right of government to interfere with the private doctor-patient relationship by telling an individual that she cannot use her private dollars to buy private health coverage for necessary medical care. We have a wonderful opportunity to give 14% of Virginians without health care a chance to join the health insurance rolls. I hope you will not deny them the full range of reproductive options that they may choose. Thank you so much for your time.
Hey, Mr. Chairman and members of the committee, just that we go with the testimony of Planned Parenthood and NARAL and go on record as also opposing this bill.
Senator Oakland, we're going to let you wrap up.
I never thought I would say this, but I want to thank NARAL for making it clear, I think if I understood them, that this bill does what federal law already does, so no harm will be done by passing this bill. So, Mr. Chairman, members of the committee, with that assurance and reassurance, I hope that it will be the pleasure of this committee to put out this good piece of legislation.
Mr. Chairman. The bill is before the committee for action.
Mr. Chairman,
Is there a motion?
with NARAL's tacit enforcement, I would recommend the bill be reported.
Is there a second?
Second.
It's been moved to second the bill be reported.
Substitute motion.
Substitute motion, Senator Saslaw.
I move that Senate Bill 1202 be passed by indefinitely.
Is there a second? Second. Discussion on the motion to PBI. Hearing none, all those in favor of the motion to PBI signify by saying aye. All those opposed? Can you record your nose? Does that work? Okay, thank you. Thank you for that. Thank you, Senator Oakland.